Spring is in the air. Welcome to the Urgent Care Association Solutions on Demand webinar brought to you by HealthTrack RX. Today we're going to talk about the role of rapid multiplex PCR to optimize clinical decision-making for outpatient infections in the urgent care. We're going to discuss cases today that are unique to spring and summer. Kids come home from spring break, we see an increase in STIs, and as temperatures heat up, traditionally there's an increase in urinary tract infections as well. I'm your moderator, Ben Favre. So to get through these cases today, we're fortunate to be joined by two experts in molecular infectious disease. First, we have Ali Prego, a clinician at Modern Pediatrics and also a medical science liaison at HealthTrack RX. We also have Dr. Stephen Goldberg, who's an urgent care practitioner at University of Louisville Health and is also the chief medical officer of HealthTrack RX. So with that, let's jump into our first case today. We have a 40-year-old healthy female who's had 3 children by normal vaginal delivery, 3 pregnancies, presented for evaluation for recurrent episodes of vaginal discharge and dysuria. Her history is recurrent episodes of vaginal discharge, itching, irritation, does not recall a previous diagnosis or treatment. Dysuria, urinary urgency, and frequency. Past urine cultures were negative. Reports post-colloidal discomfort. On exam has purulent discharge, febrilisation of the cervix, no cervical motion tenderness or nexal tenderness. Ali, you've seen patients like this before in the clinic. What are your first thoughts when you see a patient like this?
So Ben, some challenges I think right off the bat with this patient is I can't really nail down exactly what's going on, make that really definitive diagnosis just off of her history and her exam alone. So when I'm hearing her history, I'm thinking this could be a UTI, this could be vaginitis, could be an STI, etc. So I'm uncertain, but despite that, this patient, she wants her answers fast. She's uncomfortable. She's tired of this. She's had this for weeks at this point, maybe months. And today is the day she came to my urgent care and she wants the answer now. She wants this gone today. And I've certainly had lots of patients, I'm sure you all have too, where, they've had their symptoms for weeks, months, and they come to your urgent care fed up and they're like, fix this today, fix this now. So it's up to me to figure it out. So I want to get this patient the answer fast, and I want to get it right the first time. So picking the right testing is really important here.
Yeah, the clinical confusion and the urgency that, the emotion that the patient's feeling is really important. So as we go into this and we think about this patient, Ali, what diagnostic techniques and tools do you think through, and walk us through what test results you'd expect?
So for a patient like this, there's a lot of pathogens that could be the cause. The patient, she's having signs of recurrent cervicitis and recurrent urinary symptoms without a clear source. And so I have the usual suspects on mind like chlamydia, gonorrhea, BV. I have to consider the pathogens that are implicated in recurrent cervicitis. So like that's your Mycoplasma Genitalium, for example. So the test that I'm thinking about in my head as I'm walking through what I'm going to do is I think perhaps wet prep. That is typically, cheap and fast. The sensitivity, though, isn't great for trichomonas, and a lot of urgent care settings, at least the ones that I've worked in, don't have that in-house. And the same goes for vaginal pH testing. While it's helpful and can help guide me towards a diagnosis, it's not going to give me an exact answer that I need. Urinalysis can definitely be helpful to give me a clue if she has any concerns for a UTI, but I may have to wait days to get a urine culture back to get a definitive answer there too. So for me, PCR makes most sense in this situation because I can test for multiple pathogens at one time. Culture can take months to grow out those slow growing bugs like Mycoplasma Genitalium. So that's kind of out. But most importantly, I don't have to wait days for the results since PCR typically has a faster turnaround time than culture.
Very good. So test results, Mycoplasma Genitalium with macrolide genotypic resistance comes back. And Ali, can you give us kind of your discussion based on those findings, what your treatment plan would be and how you'd follow up with the patient?
Absolutely. For this patient, we did decide to do a rapid PCR recurrent vaginitis panel, and we had the answer the next morning, and it was Mycoplasma Genitalium, where we detected that there was macrolide resistance. So I was able to specifically tailor her antibiotic choices based on that test result, and I was able to get her doxycycline and moxifloxacin and get her feeling better. What I want you to remember about this case is that after we treat this patient, we need to treat the patient's sexual partners, and it's really really important to follow up 3 weeks later to perform a tested cure, since this bug has higher rates of treatment failure and antibiotic resistance. So the follow-up here is almost as important as treating the patient herself.
Great tip there. That's a great insight. And that discussion with the partner can be difficult sometimes as well. Dr. Goldberg, mycoplasma is one of those organisms that there's been a lot of past controversy around. It's increasing in incidence. Walk us through, from a population health perspective, why we need to be thinking about this pathogen more now than ever.
Sure, Ben. And Ali presented great in-room decision-making. So we offer for the viewers some notes about epidemiology, prevalence, the diagnosis, and challenges related to mycoplasma, but I'll just highlight a few points. First, Mycoplasma genitalium is definitively a GYN pathogen, and it occurs in under 2% of cases. Certain groups are at higher risk: young women, those with bacterial vaginosis history, multiple partners, considerations like that. As Ali described in this case, antibiotic resistance is a prevalent consideration, and you have to think about that actually in the process of taking care of a particular patient. There are both first-line and second-line antibiotics, and then what to do in resistant cases, such as using a fluoroquinolone class antibiotic. And as Ali mentioned, it's really critical. You have to treat the patient and confirm a test of cure. And for the partner, you've got to get that partner evaluated and confirm they don't have any active infection as well.
Great insights. Thank you, Dr. Goldberg. With that, we have our first audience survey question. How concerned are you about rising resistance of STIs like Mycoplasma genitalium in clinical practice? While we're waiting, Ali, sometimes you have these tough conversations you have to have with both the infected patient and then possibly the partner. Any tips or tricks on how to have those conversations?
Yeah, these are really difficult conversations to have, regardless if this is someone who has come in before for sexual health testing or if this is their first time coming in for something like that. So emotions can run really high. A patient can feel embarrassed about an STI diagnosis. So I always like to really emphasize that this is common and this is a treatable condition. So I also like to frame the conversation that STI testings, it's a part of routine healthcare. This is the same, getting checked for STIs and taking care of your sexual health. It's the same and as important as getting your cholesterol checked, getting your blood pressure checked. So I like to kind of phrase it like that to kind of take the stigma off and help them feel like this is normal. This is okay.
Great tip. Dr. Goldberg, about half the audience, a little over half, is very concerned to somewhat concerned about resistance with STIs. Given the prevalence of resistance and the growing resistance, any thoughts, ideas on how testing and earlier, better responses can help address the resistance issues that are out there?
Well, first, Ben, grateful that many are concerned because it shows that they are aware. So that's really good news to hear from our fellow clinicians. I think the second thing is there's usually available data, and I know our company provides it, on what resistance looks like in a given geographic area for different types of conditions. So that's good to survey. And then finally, some results offer out the observation of a genotypic resistance based on looking at the DNA or RNA of the organism. So that becomes a bit of information that can be used by the clinician to not only discuss with the patient the finding, but also the treatment planning.
Thank you both. This has been wonderful. Really appreciate y'all's insights. And thank you everyone for attending for the Urgent Care Association Solutions on Demand webinar brought to you by HealthTrack RX.